drying and warming back up to finish out the coming week. Michael?
Later.
That was it.
Well, there are a number of researchers working to find a cure to Parkinson's. Until that happens, others are working on trying to at least control the tremors. One local patient actually has an implanted device that does just that. Gary Mendel joins us this morning along with his doctor, Mathew Alexander. Thank you for joining us this morning. First off, doctor, maybe explain to our viewers exactly what Parkinson's is and maybe what the cause is.
Okay. Parkinson's is a disease in which there's a loss of dopamine neurons in the brain, and that helps control things like voluntary movements, tremors. They also control coordination of movements, and so that can make a big impairment of a patient's life.
And what about your patient? What is it that's controlling his tremors? We've been watching him now for the past few minutes. He hasn't had any type of tremors, any noticeable difference.
So the surgery for Parkinson's, so if you fail medical treatment, which is typically medications, you fail between 3 to 5 medications, and a neurologist feels that you're a good candidate for surgery, we implant 2 electrodes into the brain. We make a small incision on both sides of the brain, and we put electrodes, and we actually monitor the patient during surgery. They're actually wide awake, talking, and we test if they have tremors and make sure we're in the right location for the surgery. And we also use computer navigation to make sure we're in perfect location. So with that, and we can actually monitor the brain and the brain waves during surgery to make sure we're in perfect location. And once electrodes are implanted, we attach it to basically a pacemaker on the chest wall that controls the stimulation to the brain.
And when did Mr. Mendel have that surgery?
About 4 years ago.
4 years ago. Wow. And Mr. Mendel, you're sitting here, you've been quiet and patient. How has it been? What difference in your life has it made?
It's made a phenomenal difference. When I first went to Dr. Alexander, I had tremors so bad that I couldn't eat. I couldn't hold a glass. My hands were just like this. And you can see the results of the surgery. I'm able to do everything normal now that I could before.
And obviously, you're very happy about that. I mean, I'm smiling just hearing that. I mean, it just has to be a big relief.
It's a huge relief. It's a relief not only on me, but on my family. It's just, I can't explain how happy I am about it.
And it's held 4 years. There's no intermittent problems, or has it been pretty much clear?
It's been pretty much clear. I had one battery change in the 4 years, and that's it.
Little minor tune-up.
Yeah, a little minor tune-up, and that's it.
Everybody needs a tune-up once in a while. You know, there was news overnight that Linda Ronstadt has now said that she has Parkinson's disease. She's 67 years old. Of course, she's the famous singer that most of us have known from the 1970s. And, you know, she joins a long list of people: Michael J. Fox, Muhammad Ali, John Paul II, Johnny Cash. There were a number of people. Janet Reno, former U.S. Attorney General, who had Parkinson's. Why don't some of these people also get this? If this works so well, why aren't they getting this type of treatment?
It's typically it's mainly for patients who fail medical treatment. So once you fail multiple medications, because there are a lot of new medications out there, then they're good candidates. So a lot of times medications don't last very long. In Parkinson's, there's on-off periods. So if your on period is working very well, then that's great. You know, we want to always treat patients conservatively. Now, if you start having more off periods where you have more tremors, more rigidity, more Parkinson's disease, then you would be a good surgical candidate. Some patients can't tolerate the side effects from medications. They make them too sleepy, make them too drowsy, they have harsh reactions. So those patients can't tolerate the medical treatment. They're good surgical candidates. Not every patient needs an implant put in their brain.
Okay. And how close are they to trying to figure out what a cure might be? What have you heard lately with that?
There is no cure. You know, we can slow down the progression of the disease with medications, with even surgery. Now, the implant itself, we can adjust it. So if we want to increase the stimulation, we can. We can do different electrodes on the brain itself that we can adjust to help modify the disease process. The cure eventually, hopefully, would be some type of stem cell transplants into the area that is not functioning, but we're way off from that right now.
Okay. Well, anything else, Mr. Mendel, you'd like to mention this morning about this whole procedure and your whole experience with it?
My experience has been fantastic. I would actually recommend it to anybody that's got second thoughts about it, because it has been well worth it for me.
You weren't worried or scared about it when you first heard about
actually,
it?
I wasn't. Surprised, but I wasn't. I tell everybody that I know of that has Parkinson's now, try to get them to, go check it out. Go see about having the surgery, because it would help them. And I've got friends like that, including my brother, and they haven't done it yet, but maybe they will.
Now, you got it later in life, and we've noticed, Michael J. Fox got it earlier in life.
Mm-hmm.
Is it just an older person's disease, or is it found very often in younger people?
It's less common in younger folks. It's more common in older individuals. Now, there's two different subsets. There's an adult onset and a juvenile onset. Michael J. Fox had a more juvenile onset, an early onset. Those patients are more harder to control, and sometimes the literature shows that if you have earlier surgery, it does improve the long-term prognosis of the disease process.
Okay. Well, thank you all both very much for joining us, and good luck. And it looks like everything's working well, and that's great news. And we've got much more for you this morning, as the Canine Coach is here to talk about what back to school means for some dogs.